Over 18 million American adults have sleep apnea. It is estimated that 2 to 3% of all children have it, and over 42 million Americans have some sort of sleep-disordered breathing, according to the National Sleep Foundation. The statistics are similar to having asthma or diabetes. Sleep apnea doesn't discriminate. It affects all shapes and sizes. People of all ages and races throughout the world with all different health issues, from professional athletes to the very ill. In 1781, periodic breathing is described by a world-renowned surgeon named John Hunter. In the 1820s, a physician named John Chanes identified a respiration pattern in patients that described central sleep apnea today. In 1854, William Stokes publishes a description of a respiration pattern described by Chanes earlier that century. The breathing pattern is named Chanes-Stokes respiration. It is common in central sleep apnea, heart failure, and the stroke population. In 1836, doctors termed the phrase Pickwickian syndrome for people who had that condition known as sleep apnea, from the 1836 Charles Dickens book, Pickwick Papers. The novel's main character, Samuel Pickwick, had sleep apnea, and a quote from the book is as follows. "Sleep," said the old gentleman. "He's always asleep, goes on errands fast asleep, and snores as he waits at table." It was believed that this condition was the result of being obese, where people couldn't breathe correctly because of it. Today, this condition is termed obesity hypoventilation syndrome. It would be much later that sleep apnea wasn't entirely based on Pickwickian syndrome. Later, it would be discovered it is related not just to obesity, but over-relaxed throat and neck muscles, brain dysfunction, heart disease, nasal and pharyngeal blockages, or anatomical structures of the jaw and throat that were abnormal. In 1880, narcolepsy is first named by a physician named Jean-Baptiste Edouard Jalani. In 1889, the first medical description of obstructive sleep apnea syndrome is given by a British physician named Richard Canton, speaking at the Clinical Society of London. William Einthoven invented the EKG, the electrocardiogram, that tests the electrical activity of the heart. This is important in sleep medicine and one of the components in a sleep study because the heart is put under a lot of stress during apneas and hypopneas that make up the AHI index. PVCs, AFib, tachycardia, and severe bradycardia can take place during these episodes. Studies show that most heart attacks happen between 6 a.m. and 12 noon. There is mounting evidence pointing towards sleep apnea as the culprit for this. 1906, Dr. Sutherland Simpson and J.J. Galbraith theorized on circadian biology. Circadian rhythm are physical, mental, and behavioral changes that follow a daily cycle for all living things. For instance, when it's dark, we sleep. When it's light, we are awake. This is the body's natural circadian rhythm at work. Circadian rhythms can influence sleep-wake cycles, hormone release, eating habits, digestion, body temperature, and other important bodily functions. Biological clocks that run fast or slow can result in disrupted or abnormal circadian rhythms. Irregular rhythms have been linked to various chronic health conditions, such as sleep disorders, obesity, diabetes, depression, bipolar disorder, and seasonal affective disorder. This is important because sleep apnea directly affects this. There is more evidence that sleep and circadian rhythm regulate nearly all biological and behavioral processes from cells to your entire physiology and function. In 1929, Dr. Johannes Berger used EEG, electroencephalogram, for the first time on humans and tracks brain waves. Used extensively in medicine today to help diagnose tumors, strokes, seizures, encephalitis, and REM sleep. An EEG is important as it's used as one of the tools in a sleep study to determine how many arousals and what stage of sleep you are in within the REM cycle. REM sleep is the most important part of sleep as the body's restoration process takes part during this. It would be in 1937 that Dr. Alfred Loomis defines these brain wave patterns with non-REM sleep. In 1939, This was the birth of sleep disorder medicine as we know it. This would be the year that Nathaniel Kleitman would publish a text called Sleep and Wakefulness. In 1945, Dr. Carl Axel Exbaum discovers restless leg syndrome. There are studies showing a direct correlation between sleep disorders such as sleep apnea and restless leg syndrome. This is one of the tests used in modern sleep studies today. In 1953, Nathaniel Kleitman and one of his graduate students, Eugene Arsersky, discovered rapid eye movement during sleep, also called REM sleep. There are 5 stages of a healthy sleep cycle, and during sleep apnea, these are interrupted drastically. As stated previously, we need REM sleep for the restorative processes to take place in our bodies. What's interesting is Nathaniel Kleitman lived to be 104 years old and passed away in 1999. Remarkable life and career. In 1957, Dr. William Dement discovers the relationship between dreaming and REM sleep, and in 1958 he publishes a paper on the sleep cycles of cats. The paper on cats, believe it or not, would cause sleep research to go absolutely viral. Over the next 20 years, it would bring researchers from all different fields, from electrophysiology, pharmacology, biochemistry, and will eventually lead to Michael Jovat's identification of REM sleep as an independent state of alertness, which he called paradoxal sleep. In 1962, Dr. Dement and Mary Cascardone developed the MSLT test to identify and diagnose narcolepsy. Narcolepsy is a chronic sleep disorder that causes overwhelming daytime drowsiness. This can be seen in people with untreated sleep apnea. In 1964, Dr. Tanuski Ikematsu first tries an operation called a UPPP, uvulopalato-pharyngeal-plasty, which is a surgical procedure that typically removes the adenoids and tonsils. This surgery will be used in the future to be one of the treatments of sleep apnea. In 1964, Dr. Henry Gostat presents a polysomnograph to give the complete picture of obstructive sleep apnea that is published in 1965. This is the first official sleep study with the diagnosis of obstructive sleep apnea. In 1968, a manual for scoring sleep is developed by Ringshaven and Kales. What's interesting here is that they only meant for this to be a reference method, but unintentionally this became the gold standard in the industry. By 1969, obstructive sleep apnea was treated experimentally by tracheotomy. In 1970, effectiveness of tracheotomy for treatment of obstructive sleep apnea is reported by Lugrassi and his colleagues. This would be the gold standard of treatment for obstructive sleep apnea for the next decade. In 1972, Daikoa Ayagi develops the pulse oximeter, and this is a vital invention in the sleep medicine world. Oxygen desaturation is the biggest side effect of sleep apnea and causes the most damage to the body. This is a key component and regarded as one of the most valuable pieces of information in a sleep study. In 1975, the Association of Sleep Disorders is established with 5 centers as charter members. Insurance companies this year are also allowing polysomnograph tests to be a medical test worth medical reimbursement. In 1976, Respironics is founded by Gerald McGinnis, and he starts manufacturing anesthesia masks along with endotracheal and tracheotomy products. This will eventually in time become the first company to make CPAP commercially available. In 1979, the gold standard of treatment of obstructive sleep apnea was a tracheotomy. A physician named Colin Sullivan invents the first CPAP machine. It took Sullivan and his team a while to find a subject that suffered from sleep apnea to test his invention out on. He spent 3 years studying the breathing patterns of dogs such as pugs and bulldogs with pushed-in faces that suffered from sleep apnea. Colin invented a mask to fit over the dog's nose and continually pumped air into its snout. Colin noted that this improved sleep for the dog dramatically. Colin now needed to find a human to try this out on. In 1980, Colin Sullivan found a patient who had severe sleep apnea. Sullivan recommended a tracheotomy, but the patient refused. Sullivan negotiated with the patient, saying, "If you are going to refuse the gold standard of treatment, how about being part of my experiment?" Sullivan told him about the dog experiment with positive pressure. The patient volunteered for Sullivan's experiment. Sullivan used a motor of a vacuum cleaner with plastic tubes to create a positive pressure along with a diving mask. He put silicone around the mask to prevent leaks. Sullivan started this process at 9 p.m. that night and expected to be out of the lab by 11 p.m., as this would be a very short research experiment for him. As the patient was sleeping, the patient began to have apnea episodes right away, even with positive pressure. Sullivan experimented by using different pressures and noted as he increased the pressure, the apneas went away, and as he went down in pressure, the apneas returned. This was the first official CPAP titration in history. Colin noted while the patient was sleeping that he went into REM sleep as well. When the patient woke up, he told Sullivan that he felt awake and alert for the first time in many years. In 1981, Dr. Shiro Fujiwara first uses the UPPP procedure to correct obstructive sleep apnea. Tissues which are typically removed in the procedure are the adenoids and tonsils. Research has shown that 60 to 70% of patients who undergo this have been cured completely, and 90% have shown significant improvement. In 1983, Dr. Alan Reshafen demonstrates that humans need sleep, and without it, that there are severe health consequences and we ultimately die. By 1985, Colin Sullivan had over 100 patients on long-term home CPAP therapy. That year, Respironics introduced the first commercially available FDA-approved CPAP machines. They received a patent for bi-level technology, and they own the rights even today for the term BiPAP. At that time, they were 15 pounds. Today, the Air Mini by ResMed weighs less than a pound. In 1987, the American Sleep Disorders Association is founded. In 1989, ResCare Company, which is known by ResMed today, was formed by Peter Farrell in the selling and manufacturing of CPAP machines and equipment. In 1990, the NTSB research showing that sleepy driving causes more than 50% of all fatal crashes involving truck drivers. In 2003, New Jersey becomes the first state to make drowsy driving illegal. That same year, behavioral sleep medicine certification is started. In 2004, Dr. Sessler and colleagues first published sleep deprivation as a public and safety problem in the New England Journal of Medicine. In 2007, Respironics merged with Philips to be called Philips Respironics in a $5 billion blockbuster deal. That year, auto CPAP becomes commercially available. This will optimize therapy as we know it by regulating different pressures to give the patient the best interval pressures throughout the night while helping keep their AHI to a minimum. Also that same year, examination for sleep medicine board certification is offered under the American Board of Medical Subspecialties. In 2015, the FAA and NTSB come out with new guidelines for sleep apnea, listing it on its most wanted list for transportation and safety improvements for North America. In 2018, the NTSB determined that the two commuter railroad terminal accidents in New York were caused by severe obstructive sleep apnea by the operators in charge. Obstructive sleep apnea has been in the probable cause of 10 highway and railroad accidents investigated by the NTSB for the past 17 years. In 1985, there were 100 people being treated by Colin Sullivan for sleep apnea. Today, there are over 22 million Americans who are estimated to have sleep apnea, but only 20% of them have been diagnosed. According to the National Heart, Lung, and Blood Institute, sleep apnea can lead to serious health complications such as heart attack, glaucoma, diabetes, cancer, and cognitive and behavioral disorders. Hey guys, thanks for watching the video. Please hit subscribe. I'm not only a licensed respiratory therapist and founder of CPAP Corner here at Footit, but I'm also a sleep apnea sufferer as well. I've been on CPAP for the last 7 years, and it's been an ongoing battle for the last 7 years with me, and I will be posting a lot more videos with tips, tricks, and reviews. Thank you, and God bless.